Hi, my name's Ed Shanshala. I'm the CEO of Ammonoosuc Community Health Services. At ACHS, we provide primary preventive health care. We do so that each of us can stay healthy. Why each of us stay healthy is a very personal and unique story. The following is a personal and unique story of one of our friends, families, or neighbors and why they stay healthy.
Last year, my wife said I was squinting too much. And she said, go get your eyes checked. It's like, I see fine, but I'll go get my eyes checked. At the eye doctor, they took my blood pressure. And, growing up, sports, higher numbers are better. Blood pressure, higher numbers are not better. It turned out my blood pressure was 196 over 154. By the time I got home, my wife had arranged an appointment with my primary care provider. Hadn't seen him because of COVID. I'm one of these people that COVID caused me to step back from what I had been doing health-wise due to the isolation everybody was feeling. After the primary care visit, the doctor informed me, and I would have never guessed it, that I needed to lose a few pounds. He said, it'd be great if you took off 20 pounds. I was actually almost 200 pounds, and that really surprised me. He said, we need to put you on some cholesterol medicine. We need to put you on some blood pressure medicine. And because of that high PSA, we're going to have to schedule some tests. I went down to Dartmouth for an MRI. I'm actually very, very fortunate because the MRI indicated there was something there. The biopsy came back negative, all 16 samples. I'm trying to eat healthier and getting into that routine that, they say a habit takes 21 days. I don't know if that's true, but developing those good habits, both with eating and with exercise. I had to find time because I run a nonprofit, a small nonprofit, where we have a staff of 3 full-time staff members and a $500,000 budget. So I'm always looking for the next dollar. I think it is very important as I move forward that I'm willing to say, I've been through this. There's a sense of isolation. You go through a health scare and you're thinking you're the, it's more irrational. You're thinking you're the only one that's been through this. And when you suddenly realize that you're not alone, that there is, there can be an informal support group that says, yeah, I went through that. Comparing your war stories to say, this happened to me, there is a certain camaraderie that's going to go into it, but also that support is there. Your mental health is going to be huge when you go through a health crisis or a health scare. I choose to have a good day. I choose to be in a good mood. And that is going to carry you through. Medication is very, very important. But when you look at the impact an individual's mental health has on how they heal, how they recover, it can't be excluded.